Okay, so this is now recording. What we'll do, we're going to run through our normal pathology filing product. Not all normals are normal is the latest description of our tooling, as our tooling does far more than just pick out normals and file them. And what we like to do is follow the same format that we do with all of our webinars. We'll give an overview of the tooling. We can stop for questions, we can do a short demo, and we can open up for questions at the end as well. John and I will take the webinar. John is our sales director. Thank you for supporting. What I would ask is that if you have questions, or rather when you have questions, please put them in the chat. Webinars can be quite challenging with lots of different people talking at the same time. But if you put them in the chat, we will come back to you. And the more questions, the better. We like the questions, as it helps you understand from a user perspective of how you would integrate tooling like this. Just before we start as well, the way that we work with our clients is we run training webinars as well with our clients. So we have our new business clients, sales webinars, which is what this is, to tell you about our products. And then we have our training webinars. So in the last couple of webinars, we've seen a couple of people pop into different webinars. So if you are actually an existing client, and you've already bought our normal pathology filing tool, this isn't the webinar for you. There is a webinar on Tuesday, every Tuesday at 1 o'clock, which we can enroll you in. You just need to share with us your email address and we will do that for you. Okay, so without any further ado, we will run through our product for you now. Today's webinar is on our normal pathology filing webinar for the couple that have just joined. Brilliant. Yeah, I thought so. Okay, yeah, Marco, we'll do that. I saw your name pop up and thought, I know Marco. So what we will do is, all done. We'll look up. We'll do that straight after the call. So what I will do here, we're going to go through the normal pathology filing, so we're going to run through the presentation, and then we will take things from there. And again, if you have questions, please pop them in the chat. Like questions. Interactive webinars are extremely productive in our opinion. So this is the tooling. Our business is MyBotGP. The tooling range is called, so our business is JIFJAF rather. The tooling range is MyBotGP. And within our MyBotGP range, we have a number of products for primary care, and those include a normal pathology filing tool for both EMIS and SystmOne. We have a document automation tool, which obviously is for document, and we have a repeat prescription automation tool, which is currently live in EMIS and will shortly be live in SystmOne as well. Okay, so what is MyBotGP? So again, I've just seen another name I recognize here, has just popped into the conversation. This is a webinar for people looking to acquire the tooling. We have additional webinars for people who want to enroll in our training. So right, get stuck into it now. Who are we? We are a specialist in automation products for primary care. We are also a strategic partner of HBL-ICT, which is quite unusual. HBL-ICT are an ICT, government-owned, funded, non-for-profit that support GP general practice in the same way that they do for lots of other of your products. And all of our kit lives in an ICB. Why is that important? Well, it's important from a data and security and compliance perspective and a credibility perspective. Anything that you buy through us will live in an NHS hosted environment. Super important. So DTACs, DPIAs, data sharing agreements, all that stuff is quite straightforward. We were also part of a Health Innovation Launchpad program several years back, which was a government funded program for launching innovation in tech. We completed that several years back. We were in cohort 6. This slide, I think reads for itself. It's jovial but serious at the same time. People are not good at reconciling how long things take. What does that mean? We're not very good at having our perception of how long things take is often not accurate. 5 minutes here, 5 minutes there, 10 minutes doing this, 10 minutes doing that over a period of a year is a lot of time. You know, a couple of cups of coffee or tea a day 15 minutes a day while you're waiting for the kettle to boil or make your tea equates to 91 hours a year. It's a lot of time. If you're working an 8-hour working day or a 9-hour working day or a 10-hour working day, you can see how many days, 8, 9, 10, 11 days a year, which could potentially be allocated to something else from losing 15 minutes a day. So in relation to this product, which is our normal pathology filing product, which invariably normal pathology tests and abnormal pathology tests are filtered and managed by clinicians, that's 91 hours a year for every clinician. Well, actually, we'll come to that stage in a moment. That's 15 minutes a day, will be 91 hours a year lost. If we come to the business case, an average list receives about 8,500, or on average, an 8,500 list receives about 200 pathology tests a day. That works out a staggering 62,400 path tests a year, and our tool can look after pathology tests, so not just blood results. Approximately 30% of those are abnormal. If additional checks can be added to filtering out whether a normal is really a normal. So what does that mean? So that means in this scenario, just under 44,000 pathology tests a year could potentially be managed for you. And by managed, we don't just mean filed and not looked at because they're in range. With our tooling, you can add additional rules to filter on that. You can read the patient history to look for previous conditions. You can read the pathology report to look for keywords or warnings. You can compare tests against previous test results for percentage increases or decreases. We'll cover that off in a moment. There's all manner of different checks that can be done. So what does that mean in real terms? Well, based on 4 partners or 2 partners and 2 locums or salaried GPs, however the combination is, but based on 4 at an 8,500 list, that works out a potential time saving of 19 days a year per clinician. So that's 78 days a year of clinical time could be saved and allocated elsewhere. And there's obviously a cost footprint for that, and there's a physical output of what else could be done or not done. Perhaps they could go home on time for once. So MyBotGP is there to help you get that time back and enforce standardization, which we'll cover off as well, if that's something that you want to do. So you can reduce your cost footprint, you can focus on other work, you may even be able to go home on time. I'm sure you'll find other work to do. So our mission is to reduce practice costs and help you smarter by using the most advanced automation products. As we touched on before, all of our kit lives in an ICB safe environment. We have a DCB 0129, which for those of you who aren't aware is a clinical risk certification. It's very important, and we have that, which we can share with you if you proceed with our products. What's super important with our products is they can be bespoke at practice level. We do not tell you how to filter or what rules to add. That's not what we're about. We give you a platform where you can decide how you can filter and what rules you can add in order to determine whether pathology tests, in this example, need further investigation. And the reason we do that is everyone has a different opinion. Labs have different ranges. They use different keywords. One doctor might want to evaluate something in one way and another in a different. So you're able to do that through our platform. The way that we're priced, we have practice pricing and we have PCN pricing. Of course, there's a discount at PCN level if you acquire our products. And if you do acquire at PCN, what's important to say is that at PCN level, every practice still gets their own copy, which they can bespoke as they want. So 5 practices, 1 PCN, you can have different rules if you want. You're not stuck with the same rules, and you can change those as much as you want. So think about MyBotGP conceptually. MyBotGP is a remote worker. We'll cover off the rules and the logic and the filters that you can add in a moment, but we want to set the scene as to what this tooling is. So it's a remote worker. Think about someone at home, and you've given them permission to look after some pathology tests for you, and you've told them which pathology tests and what to do with them. That's what this tooling does. You set the screening rules. You can accommodate differences in approach. You confirm which pathology test MyBotGP will look after for you. Again, we have clients who are using this tool to look after up to 200 different pathology tests. MyBotGP will read all of the pathology tests, including every line on larger reports. It identifies the tests it has permission to check, skips the ones it doesn't. Once identified, the ones it has permission to check, it will use your rules to confirm if normal or abnormal. If it's normal, the test can be filed. And if you want to send an SMS, you can. And if you don't have to. Archiving protocols we don't touch. They're quite simple to do in EMIS. What does that mean? Well, what it means is we have a selection of clients who want MyBotGP to pick out the normals, add additional checks, and if it passes all the additional checks, they simply want the pathology test filed and removed from their inbox and a message sent or not sent. And we have other clients that don't want to do that. They like to leave them in the inbox and have someone periodically run spot checks. So that's up to you, and we can cover that off in more detail further down the line. Essentially, what we're helping you do is prevent a scenario where stuff comes in, gets looked, filed, and no one gets to see it. So that is not the case. Rules are easily changed, and there's a comprehensive audit log. So anything the tooling touches, there's a footprint for. Okay, so I have a slight cough at the moment, so I may stop for drinks if you just bear with me a second, and we'll go into what the rules are. So not all normals are normal. What does that mean? What that means is that not all normals are normal. As you know, a normal pathology test may not be normal. How would you determine that? Well, you could determine that by looking at the patient record and looking to see whether they have a health condition or on a specific medication, which would mean that despite that test being normal, it's not normal. And then you may decide that you still need to look at that test, or you could decide that you don't need to look at that test. Those decisions are up to you. But the way that that's leveraged through our platform is you can safely configure pathology tests, check using any of the following filters, and you can use all of the filters on every pathology test, or you can use one or two or three. It's completely up to you, and we'll show a spreadsheet in a moment with a batch of how your colleagues across primary care, examples of how they're using the rules. So firstly, do you agree with the lab? If you agree with the lab, and MyBotGP has the lab ranges pre-configured in the panel, and you're happy to file based on the lab, then it will agree with the lab. If there are scenarios where you want to set slightly different tolerances to the lab because you believe it's safe to do so, you can do that. You can supersede the lab ranges. So MyBotGP will read it and it will go on your ranges. So we have some clients with clusters of tests where they believe one or two of the subtests there could be a slightly higher tolerance on if the remainder of the tests are okay. Again, it's up to you. We have other clients that don't do that. You can tell MyBotGP to read the path test. And then for that specific path test, go back in the patient record, look at a previous path test and see if it's increased by a certain percentage. It's able to do that. And the super powerful piece that adds masses of additional capability in terms of what path test that you can look after, keyword checks. So what you're able to do is MyBotGP can go into the patient record, read the patient record, look for health conditions, medications, keywords, and it's also able to read the pathology test report. So going back to the example I gave before, and I'll show the examples in a moment on the spreadsheet, someone with prostate cancer could come through as normal. However, you've made a decision that you still want to see that test. So you write into MyBotGP, even if it's normal, still have a look in the problem page. And if it says cancer or metastatic cancer or whatever keywords are linked to that patient, skip it because I want to have a look at that. Or you could say file it. And then, of course, on the actual path report for HbA1c, it could say diabetes or pre-diabetes. So in some scenarios, you may want to see those tests. So you can write it next to it and say, read the path report. I don't care if it's in range. I still want you to do these other checks. Do I need to check against the previous test result? Do I need to look for a keyword? Do I need to compare it with the previous test? Do I need to separate it off in terms of age or gender? You're also able to omit patients as well. So in some scenarios, there may be some patients that you just don't want that you don't want any automation looking at. So you can drop them in and MyBotGP will ignore them. You can also send text messages using Accurix, or if you're using SystmOne through SystmOne have an inbuilt messaging system. It will leverage it in exactly the same way. And you don't have to send text messages. Again, depending on budgets and so on and so forth. You can decide upon which tests you want to send messages for. So they're the rules. Do you agree with the lab? Do you want to supersede the lab? Do you want to compare tests? Look for keywords, omissions of keywords, read the path report, patient history, separate age, gender, omit patients. It's super easy to configure. It's about 3 hours, 3.5 hours of clinical time, and it's fully up and running. And it doesn't all have to be done in one go. So this is the configuration panel. So MyBotGP will have been plugged in and it will have read all of your pathology tests and save them all in the memory. Not patient data, just the tests. Why does it do that? Because it has to get the correct names and all of the correct ranges from your lab. So you could be comfortable that all of the ranges it's presenting to you in relation to that test have come from the lab. So it's sucked that up by itself. So for this scenario, this is a liver function test. Let's say this is what your lab says is the correct ranges for a liver function test, for example. This would be in purple. You'd double click, open it up, and it would look like this. Your first decision is, do you agree with the lab? And if you do agree with the lab, what do you want to do with it? Are you happy to file it and never look at it? Okay, if that's the scenario, you click here where it says file for normal report. And then the next time it sees that test, as long as everything is in range, if any one of those fails, is out of range, it will fail. If they're all in range, it will file it. And if you want to send a text message, you tick that box. And if you don't, you don't. Now, let's say, for example, you don't agree with the lab, or you do, but you want to add additional checks. Well, you don't tick that box, and then you can quite easily just put keywords. Here's how you look for the keywords. No keyword check, check if the keyword is present, absent, or in the problem page. You click the appropriate box and write the keyword to look for. And we've got examples of those we'll show in a moment. Next, if you want to change any of the ranges, you just literally click here, put the new number in, press save. Or perhaps with one of these, you say, I'm good with all of these. However, I don't want this to have gone up by more than a certain percentage. So where it says check previous test result, you just click here, click yes, and then you write the percentage increase that you're happy with or not happy with to act as another filtering rule. And then obviously you've got age and gender. So you can very quickly layer in the additional checks to pick out that not all normals are normal. Validating the lab, superseding the lab if you want to, comparing against previous test results, reading for keywords, problem page, checking for medication or health conditions in order to determine whether you still want to look at that test, that path test result if it's coming in as normal. Okay, so what I'll do before we stop for questions is I will share this brochure, this spreadsheet here. Hopefully you will have been sent a copy of it by Deandra in advance of this call. If you haven't, we will share this along with a copy of the recording of the webinar afterwards. So what you're looking at here is one of our clients shared some of their logic. I think there's 181 different path tests on here. And what you're seeing is the rules, the way that they added, what you're seeing the path tests that they felt were able to be looked after by MyBotGP using a combination of those rules. So here you have the name of the path test, subtest name, gender, age, ranges. Here you can see check previous test result and keyword checks and the comment string for filing. So I'll show a couple of examples of how they've done here. We always like to show the same ones. Prostate is an interesting one. Here, lots of our clients use this logic. They've set up 5 different ages and ranges. So MyBotGP will log in. It will see a prostate test. It will say, yeah, I've got permission to do that one. It's going to open it up. Okay, now what rules do I add? Well, how old are they? 5 different ages and ranges. Are they in range or out of range? Do I need to check against the previous test result? However, for all of those, what this particular client has said, I want you to do a keyword check for prostate cancer, metastatic prostate cancer. And what they wanted it to do is if it saw that keyword, skip it, leave it for a doctor to look at. We have other clients that don't use that logic. What they do is set a set default of a range. If it's out of range, it's a fail. If it's in range, it's a pass. If it's a pass, if it's in range, and check it against the previous test result. And even if it's in range, but it's increased by more than 10% since the last test, they believe that's too quick, fail it, and they want to have a look at it. So where I'm going with this is there are differences in approach, and that's one of the unique selling points of our tooling. You can bespoke it. So coming back to a PCN acquisition, there's no challenges at PCN level across practices where you'd all have to use the same logic. You can configure it as you like. You can see the keywords being used here for this particular test. Let's see what that one is. Yeah. We've got our HbA1c here. This was the example that we gave before. HbA1c level standardized. Ranges. Don't worry about a previous test result. However, you do want to look for keywords, diabetes, pre-diabetes. The keywords are super powerful. You can see here. And again, we'll share this document, and we've got several of these documents that we share with all of our clients, which will help you get your eye in quicker as to how the rules can be configured. Doesn't take long to actually configure the tool, about 3.5 hours of clinical time. So I'll just run through the rules one more time, and then we can stop and see if there's any questions. If not, we can carry on. So it's going to log in like a remote worker. It's been told what to do. It's been told what rules to apply. It's been told what path tests it's going to do, and it will run by itself. So you don't have to do it, and it will run every day, 7 days a week. You could have 50 tests to look at. You can have 500 tests to look at. It makes no difference. It's going to do them all for you, and it's going to complete its work every day. Once it's found the path tests, it's going to say, right, what have I been told to do to validate this test in terms of whether it needs to be seen by someone or it can be filed. And that is a combination of any of these rules. Agree with the lab, supersede the lab, previous test result, check for comparison for increases or decreases, reading patient history to look for medication or health conditions, reading the path report for any warnings on the path report, age, gender, and omitting patients. And some tests don't have ranges, they only have path reports, they only have keywords, so it can use those as well. Quickly configured through here. Okay, so that feels like a good time to pause for a moment. It's quite a lot of information to go through in one go. I guess over to John. Are there any? I can't see the chat. Are there any questions in the chat?
There was one question from Daniel, just asking if the information slide deck and so forth will be shared within post session. So I just mentioned to Daniel, yes, that is what exactly will happen just after we finish up.
Good stuff. Yeah, 100%. In fact, in principle, you should have been shared one already. So we'll check and see what happened with that. This deck, copy the video, as John says, and we'll send a copy of that spreadsheet as well. And for good measure, you'll probably get our document overview as well. But and any other questions?
One has come through from Rav. If the result requires a GP to review, can it be sent to a GP who has ordered the test?
Okay, no, it will stay in the inbox, and then it needs to be distributed from there. So the way that we've addressed that, because different GPs are in and out on different days, and sometimes people are away, so having it sent to that person and somebody else doesn't have visibility over it could be a challenge. So what I can share is some of our clients have set this up in different ways. They have centralized, they've changed to a centralized inbox. So people can pick the path tests out of there, and then they've grouped them within EMIS or SystmOne, or they have someone cast their eye over them and distribute the remaining path tests to the appropriate people. But in principle, what we're seeing is most people just log in and they grab the abnormals. Any other questions?
Nothing as yet.
No, just hold on a second and see if anyone else pops in.
Sure.
Okay, good. Okay, so what we will do now is I'm going to show you, we'll show you a short overview video demo, and then if obviously have more questions, please pop them in the chat, and then we will stop and ask questions again, or answer questions again afterwards. So if we come into here, and we're into here and here, can everyone see my screen? That all? Yeah. Okay. Good stuff. There's this one. We've got more EMIS or SystmOne clients on here today. This is the question. Okay, I'll show an EMIS, but the tooling works in both EMIS and SystmOne. I have a new laptop, so it's downloading. So bear with me 1 second. Okay. Just take it to here. So this is essentially what you were looking at on the slide deck, but that's in reality what it would look like on your screen. So that's a full blood count picked up from a lab. Super important that these are the ranges that are linked with that lab for these particular tests. As everyone on this call is aware, different labs will have different ranges. So one of the ways to ensure the safety of this tool is what it does is it grabs the ranges from the labs. We're not asking you to go and look up the ranges and add them in or anything like that. That would be a massive investment in time. Our tooling will plug in and it will read all of the ranges, suck them all up, and it will pre-populate them here. So from a clinical perspective, whoever is going to sign this tooling off, who's going to validate the rules, it's as simple as double click on full blood count. It would be in purple. It will open up. And as we showed on the slide, do you agree? Or do you need to do a keyword check or check if a keyword is present or absent or in the problem page? Do you want to file for normal report? Send an AccuX message. What comment string do you want to file with? Do you want to check against the previous test result? You would do here, and then the percentage increase or decrease. So this demo goes back some time from when we used to self-configure, but what we're showing here is you can add in additional checks. Go into here. It's actually redundant now because we suck them directly from the lab. So the next one would say HbA1c, a good example. This is what it's done, diabetes, send a text message and save. So that's now been configured for an HbA1c test. You want to send a text message. Some may want to, some may not want to. And what keywords look for in the problem page? Diabetes. So, and of course you can add a range as well. So if it sees that word, it's going to skip it, say abnormal. If you want it to, and some people are quite happy to file. And again, we'll share all of our literature, showing what different clients, how different approaches different clients have taken. Same principle for here. Take that back here, that was quite quick. So if it doesn't say antibody and they're comfortable with those ranges, so that's the safety. Let's show a couple more and then we can actually show the tool working. And what we're saying here is that if there's, and we're manually writing this in just for demo purposes, but actually in reality, if there was a new path test from your lab that MyBotGP has never seen before, it's going to grab it and it's going to present it to you and say, I've just spotted this new one, I've never seen it before, and here are the ranges. Firstly, do you want me to add it? And secondly, what rules do you want to add? And you would simply add the rules that you want. Okay, so we'll move to the next slide. John, did I see a question come in?
No, we're all good. You continue.
Okay, good stuff. So we'll go to here. Give it a second to download. So the stuff on here has been redacted. One of our clients let us take a recording of it because we wanted to show MyBotGP in action for real. So you'll see some stuff blurred out on here. And what you're looking at now is logging in. The tooling is logging into EMIS. And again, it works with SystmOne as well. Logging in with its own username and password, which is really important. So you've got a full audit log. Anything that MyBotGP, it's a good point actually. Anything MyBotGP touches has a footprint, so you know. So there's no confusion around who's looked at what tests. And what you're seeing now is the tooling logging in, and again, all the patient information has been redacted on here. It's logging in and it's navigating its way through EMIS, looking for the path test, then it's going to identify the ones it's been given permission to look after, and then it's going to apply the rules, and then based on what it's seen, it will say whether it can be filed or whether it should be skipped. The automation works by replicating what people do. So it's simply using the computer in the same way that a person does. Username and password, login, only got permission to access particular areas, and then it's locked down in terms of what it's allowed to do. And in this scenario, it's validate normals and action them. So John and I were on a call this morning, just before this, where the practices were saying that I think there were a 10,500 list. Was it four partners, two salary GPs, and they're spending a lot of time manually filtering and validating. Once you get your head around the 15 minutes a day calculation is 91 hours a year, it's you can quite quickly see where time goes and where you can get time back. The reason that we've been doing this or you've been doing this as people, is because there's been no one else that could do it for you. Well, now there is. Okay, I think that's nearing. Oh, it's a bit more on there. We'll just let that run for another minute or so. Just going to move to the next page. So the way that it works, it will log in 3 times a day at set time periods, empty what's ever there, and then it will circle back and come back in again, and you'll be sent an audit log at the end of each day. So some of the stuff to think about at practice level is everyone being aware that you're starting to use automation tooling and not filing them. So there's a bit of change in the way that people work. They're building confidence to leave them, and having the confidence that by a certain time in the day or the following day they will have been actioned and nothing's been left behind. And in fact, this will work 365 days a year, so it's going to run weekends, holidays, bank holidays as well. Let that run for a minute more, and then I think we'll stop and see if we've got any questions we can answer. If not, then we might all get 20 minutes back of our day today, which I'm sure everybody needs. So I can carry on here. I'm going to just show you where that finishes off. So it finishes around here. Okay, so I'm going to stop sharing now. We'll do and jump back in and see if we've got any questions. If we haven't, I'll do another quick summary of the we'll let John run through a quick summary of the brochure if you want to go through the rules, and then we can stop. So do we have any questions?
Nothing further at this stage, James. Maybe just a quick recap.
Okay, so what I'll do then is I can share my screen, John, for you. If you tell me what you want me to do. If you want to just spin through again, it's nice to have different people describe a product, as you get slightly different views or opinions on how they're described. But I'll hand over to you if you tell me what page you want to go to. And
well, let's focus on the filtering rules. I think that's the core of it, right? Because that gives you the idea that there's safety and that the guardrails are based on your own level of comfort in respect to risk and risk mitigation. So as James said, you have the opportunity to use a minimum of 1. If you're happy with the lab ranges and in your experience there's ever been any issues, you click that little button and it will continuously do what you've trained it to do, nothing else, nothing less. You have the ability to supersede the range labs, or the labs ranges. So if in your experience you know that the typical ranges could be wider, could be narrower, and so forth. And in your experience, there's been nothing that it sort of affects safety. You can do that. You have the ability to go back into the patient record and compare previous tests. You can set that for a number of days and then change your tolerance levels on that as well. We'll look into the path test as well as the patient record. And as James said, one of the most powerful things is the keywords and checking whether that's present or absent and so forth. And here's really where you can set the guardrails based on your risk appetite. James spoke about looking at standardization, and there's going to be different generations within different businesses in terms of GPs. And it's important to kind of align and say, well, how risk adverse are we? How conservative do we want to be? So anyone can really sit down, have a conversation and go, we want to be risk adverse, use all of these different filtering rules and logic. To sort of add to that, you have the ability to separate out on gender as well as age. And then if there are certain patients that you would not like to have the automation touch, you can admit those. And once again, as James said, there is a audit log. So you can see exactly what's been filed by category. If there's anything that the bot has not seen and requires you to take action and says, well, kind of train me up. And basically after it's been given permission, it gets enabled, goes green, and then it picks that up the next time it sees that. Of course, you have the ability to send SMSs should you choose so. And not only do you have that audit log on the machine, you also have a distribution list that'll go at 5 p.m. and you can choose as many people as you want to be part of that distribution list. Gives you the same type of information that you would get on the audit log within MyBotGP.
Brilliant, thank you, John. And good stuff. So just to finish off a bit on pricing, and John will keep an eye on the chat for any queries. We have we believe a very clean pricing model. This tool is designed for small practices, medium-sized practices, big practices, and PCNs. Everyone will get their own copy to bespoke as they want. There is no limit on pathology tests and volumes, so it's unlimited pathology tests and volumes. And essentially our pricing is quite straightforward. Per product, and for EMIS, obviously, we have pathology filing, document, repeat prescriptions. SystmOne, we have pathology filing, repeat prescriptions shortly, and soon there'll be an equivalent to document, but the pricing is the same, 749 and list times 30 pence. So an average practice, we'll do the calculation in a moment. And then there's a hosted service or cloud service cost as well. So a list of about 10,000 patients would be 30 pence times 10,000, so I think £3,000, so it'd be 3,749, and then about £60 a month for hosting. So you're looking at sort of £4,500 a year, based on an average list of 10,000, and that's for unlimited path tests and unlimited categories on an annual subscription. If you take a second product from us, that's discounted to 449. And then list times 30 pence, and the hosted service is charged at 5p. So it would be your list times 5p. And then a ballpark for PCNs, because they're all different sizes. It's about a 10% reduction on PCNs in cost if you're to acquire as a PCN for all of your practices. So I will one last check to see if there's any questions. Again, this will be the recording will be distributed to everyone along with a copy of the brochure and the spreadsheet with the pathology test examples on there as well. After the call, and if anybody wants more information, please come back to us. But before we wrap up for today, are there any more questions anyone wants to put into the chat? Let's give it a minute or so. Okay, doesn't look like any question. Oh, thank you, Daniel. Brilliant, you're welcome. Thank you, Taylor. Good. Good stuff. I can see someone just writing something. Let's just wait and see whether that's a question. If it is, we'll answer it. I'll give that another minute or so, 20 seconds
pressure.
or so. This would just press the key by accident. It's just saying typing. Oh, yeah. Okay. All right. Good stuff. Thank you. Thank you for joining today. We will wrap this up. We will log it. We'll put it on our website and we'll share the link afterwards. Obviously, we'll invite you to other webinars as well. And if anybody else wants more information, please come back. Thank you for joining today. And thank you for John to support. And good stuff. Thank you.
Super. Good day, everybody.